GBT. Guided Biofilm Therapy is a systematic, predictable, and scientifically proven protocol in professional prophylaxis, being minimally invasive and pain-free. GBT is a game changer. Step 1. Assess every clinical case to individualize the treatment plan. Start by rinsing with Bacter X Pro mouthwash to minimize the bacterial and viral charge in the aerosol. Step 2. Disclose biofilm with EMS biofilm discloser. The color guides you to remove biofilm faster and more accurately. Step 3. Motivate and educate your patients in oral hygiene. Evidences suggest that professional biofilm control shows similar bacterial growth to non-treated patients without adequate daily care. Step 4. Airflow Max removes biofilm supra and subgingivally up to 4 mm for natural teeth, restorations, implants, orthodontics appliances, and soft tissue. With Airflow Plus powder, only 14 micrometers, gentle, efficient, and comfortable. Step 5. The new and slimmer PERIOFLOW nozzle reaches up to 9 mm of pocket around natural teeth and root furcations and around implants, whilst preserving the hard and soft tissue. Step 6. PIEZON PS is only a final touch in GBT. You can use instrument PIEZON PS for 95% of all cases with no pain to remove calculus supra and subgingivally up to 10 mm. Step 7. Check for remaining biofilm and calculus. You can now diagnose caries more accurately on clean teeth surfaces. Step 8. Schedule recall according to risk assessment. Regular recall is the key to successful oral health. Following the 8 steps of GBT, you can maintain and prevent periodontitis, peri-implantitis, and caries in an efficient and predictable manner. No polishing anymore. GBT is good, beautiful, and true. Be a game changer with GBT.